I'm introducing our next speaker, Ms. Donna Smith. She'll get the microphone fixed. Donna described herself to me as just a patient. Well, she's not just any patient. Her and her family's unfortunate plight brought her to the attention of Michael Moore, who gave her a role in his movie Hsiao. Donna will speak today on behalf of the Maine State Nurses Association.
Thank you. Thank you, everybody, and thank you, Maine, for having me here. How nice to be here, and in the fall. What a great time. I'm here today, though, representing the Maine State Nurses Association, the National Nurses Organizing Committee, where nurses believe that their primary responsibility is to be patient advocates. And in order to advocate for their patients, they must have a healthcare policy and system that supports a single standard of high-quality care for everyone. We don't have that. And we believe that can best be achieved through a single-payer system. Unfortunately, today's healthcare structure in Maine and nationally means our nurses' professional responsibilities and day-to-day activities to truly advocate for patients are constantly disrupted by the profit-making and revenue-generating priorities of the insurance, hospital, and pharmaceutical industries. I am not a nurse, but I'm blessed to work for 180,000 of them since about 8 months after Hsiao came out. I like to tell people that I carry the nurses' message wherever they ask me to carry it, from coast to coast. I've been in 43 states, the District of Columbia, and this weekend in Windsor, Ontario, Canada, talking about single payer. And the Canadians, by the way, were asking me, what's going on with you guys? It's hard to answer. But I wanted to share with you that no one aspires to be in a Michael Moore film. It's not something you generally grow up wanting to do. It means something pretty awful has happened to you. And the dire consequences that happened to me and my husband happened as fully insured people, always carried insurance. But because that insurance system it's a financial product that's sold to us to protect our health and our wealth, which may do neither thing. It's a financial product. Health insurance is not health care. So whether our Maine state nurses are fighting for safe staffing and their contracts are supporting guaranteed lifelong health care for all in Maine and nationally, it is with this in mind, providing and protecting a single standard of high-quality care for all patients should be the top priority of any healthcare system, and we urge Maine to step on board and get that done.
Been introduced a few times before. I don't know if he needs an introduction here, but I'll say it one more time. He's an internationally recognized authority on healthcare financing. He has consulted to many countries around the world. He was the chief architect of Taiwan's national health system, and the Healthcare Commission of the state of Vermont chose Dr. William Hsiao to design options for a Vermont state healthcare system, including a single-payer option. Dr. Hsiao's testimony to the Select Committee is included in your press packet. He'll make some brief remarks, and then I hope all of the speakers will be pleased to take your questions. Dr. Hsiao?
It's an honor and a privilege to be here, and I just finished testifying before the Select Committee, so I will not repeat what I said there, other than just say, I think countries like Taiwan has shown how a country can go forward when you have a broken healthcare system that includes, let's say, how the insurance operate and how many people get excluded from adequate health insurance, as well as how healthcare can become unaffordable for people, and the way go forward that you can actually bring that down to an affordable level. So Taiwan was struggling with the problem that confronts Maine and the United States. That was Taiwan realized it had a serious problem and this system is broken, and then saw the way out of that. And since Taiwan established its national single-payer national health insurance, the system has improved the access of health care for its people. Everyone in Taiwan is covered by comprehensive benefits, and also the cost is under control. And the quality of care has improved, and as well as there are, for patients suffering from stroke and heart attack, their health outcomes actually have been improved. So all these, what Taiwan illustrates is you can actually have a system that fixes the problems you encounter in a broken system like what we have in America today. So the question for Americans is, how do we go forward? One, do we acknowledge we have a broken system? And two, then, to embrace the experience and knowledge we have from the world and move to a new system. Thank you.
Are there any questions for Dr. Hsiao or for any of our other speakers? In the back? Yeah.
Am I the back?
You're the back.
You want to identify yourself,
Yeah,
please?
sure. I'm Peter Stuckey. I'm a state representative from Portland and I sit on the Health and Human Services Committee. The question I have is, why do you think that the healthcare system and the healthcare outcomes in Taiwan have improved?
Well, the healthcare system is improved is because in the system Taiwan had today, like America, really we have contradictions in the system itself. Like I point out, the fee-for-service payment method promotes inflation. And so meanwhile, all of us are trying to make healthcare affordable. Yet we have an incentive structure which making that make the costs just keep going up. And we rely on private insurance trying to achieve universal coverage. But as I point out, private insurance, for-profit private insurance plans, their duty, rightly so, is to their stockholders. Their stockholders invest money in the company to make money, to make profit. And the profit comes from having the companies excluding, not insure the elderly people, the unhealthy people, but just cover the low-cost patients, which are the young and healthy people. But meanwhile, insurance is trying to protect people who have faced these risks. And so we have a contradictory system. And so it requires a holistic reform rather than just to take one part and fix that at the time and think you have solved all the problems. It's just like a car. If the transmission is broken, the engine is broken, but meanwhile you're trying to fix the tires, that's not going to deal with the major problems that's interconnected. You don't have power if your engine is not working right, and even the engine is fixed, you cannot transmit that power to the wheels without good transmission system. And that's the problem the United States face today.
Murray Carpenter, Maine Public Radio. A couple of statistics I wonder if you have at the tip of your tongue. In Taiwan, the percentage of GDP spent on healthcare, say, 94 versus in the U.S. at that time, and the percentage of GDP they spend now versus what we spend now on healthcare.
I remember the statistics for now. The Taiwan right now in 2009 spends 6.1% of its GDP for healthcare. United States last year was spending 16.7% GDP for healthcare, more than 2 times of Taiwan. Back in 1994, Taiwan was spending roughly about 5.7% GDP. I don't remember exactly what the United States spent then back in 1994, but I know it was, again, is about 2 times, a little bit more than 2 times. But the gap, the difference has widened since 1995. Taiwan has controlled its healthcare costs, but the United States continue to escalate its healthcare costs.
Well, this is Dr. Caper, and my view is that this is about almost 100% a political problem. And I think the people simply have to mobilize and organize and educate about what's really going on. That's what Maine AllCare is all about. We're currently, in 2009, Mainers consumed about $10 billion worth of healthcare services. So that works out to about $8,000 a person, a little less, $7,500 a person. Family of 3, that works out to over $21,000 a year we're spending on healthcare in Maine, in a state where the average income is roughly in the mid-30s, 30,000 or so. Most people don't feel all of that because they're spending on healthcare in a variety of ways through direct payments, premiums, uncovered services, co-pays, deductibles, taxes, depressed wages. John Newton tells me that the last few years the workers have been bargaining, they've given up bargaining on wages and working conditions. They're now bargaining almost exclusively on health care just to stay where they are. And it's getting more expensive every year. So there are all kinds of ways, and we'd like to begin with the people of Maine to explore what's really happening. I think public education is a major tool and a very important one.
Just wanted, I mentioned to Phil a minute ago, we have a collaboration going now between about 19 states that have a conference call every Friday at 11 a.m., a collaboration of states working on single payer. And we have from California to Minnesota, Pennsylvania. Pennsylvania actually has Republican co-sponsors on their legislation, which is interesting, arguing the economics of the situation for Pennsylvania. So we want very much to have Maine represented on that call so that we can grow that collaboration stronger, where states can learn from one another what's going on in the other states, what has worked, what has not worked politically. We've talked about model legislation. We wait with great anticipation the results of the study from Vermont, because one of our feelings is if we can learn from that study and model legislation that addresses some of the concerns that may be there and have some synergy of effort, get smart about it. The opposition is very smart in the way they address these things, so we want Maine with us, and we're going to all be smart, and we'll get there.